Hi, my name is Destiny Thurmer, and I'm going to be performing my trach care video today, following my general principles and safety practices. But to knock, hi, my name is Destiny. I'm going to be your nurse today. I'm going to start out by providing privacy and hand hygiene. I'm going to use 2 patient identifiers and assess for allergies. My patient cannot speak, so I'm going to look at her wristband and then ask, is your name Sally Smith? She is shaking her head yes. And is your birthday 1/23/1982? She is shaking her head yes. Do you have any allergies? She shook her head no. And are you in any pain today? She shook her head no. If she was in any pain, I would administer pain medication following my 11 rights and 3 checks before the procedure. Then I would explain the procedure to the patient and let her know anytime during the procedure if she needs me to stop her in any pain to just lift a fist up, and I will stop. Now I'm going to lift the bed to a working position and putting my patient in a semi-Fowler's position. If she was unconscious, I would put her in a side laying position. I'm going to start out by laying this waterproof pad across my patient. Ready? And hand hygiene, and I'm going to open my sterile kits, maintaining a subset technique. Alrighty. Now I'm going to get my saline, open it, lip it over the trash, and pour that in. Ready. Hand hygiene, going to put my face mask on, or face shield, and don my disposable gloves. Okay. Now I'm going to stabilize the faceplate and remove the old inner cannula and dispose of that. While stabilizing the faceplate still, I am going to remove the old dressing, toss that in the trash. Okay. Now I am going to remove these gloves and perform hand hygiene. Now I am going to put on my sterile gloves. Okay. I'm going to open up these, dispose of that. Ready. Making sure to only touch the 1-inch border, I will open these. Alrighty. Okay, now that I have my sterile gloves on, I'm going to put a new inner cannula in. So I'm going to grab this. And whenever I come over here, I'm going to stabilize the faceplate. Insert this in. And make sure that is secure. Alrighty. Now that that is done, I'm going to clean. I'm going to grab my swab, dip it into my saline. Okay, stabilize the faceplate. I'm going to clean the top and bottom under the faceplate next to the stoma. Okay. I did the top, discard that. Grab my other swab. Making sure to still keep that stabilized. Doing the bottom now. Okay. And that. Now I'm going to pat dry. Start of that one. Pat dry at the top. Alright. Now I'm going to replace the dressing with the new dressing. Stabilizing the space plate. Going to apply this dressing on. Alright. Now once the new dressing is on, that is good. I am going to change the collar using the one-person technique. So I'm going to take my collar. I'm going to lift the patient's head up. Place this around the patient. And since I'm using the one-person technique, I'm going to stabilize the faceplate the whole time. I'm going to keep the old collar on until the new collar is fully on. If I was using a two-person technique, I could already remove the old collar and have that person stabilize it for me. So I'm going to while I'm doing this, I am making sure that I'm holding onto that face plate, just making sure that it's not moving. Now that I got the new collar on, I'm going to release the old collar. Okay, that faceplate is still good. Take that out. Get this side off. I'm going to gently lift my patient's head back up and remove this collar, dispose of it. I'm going to make sure that you can only put one finger in between the collar and the neck. I have good neck mobility. Make sure the patient isn't in any pain after this and she's doing fine. Now I'm going to clean up and take off my gloves. Ready? I'm going to do hand hygiene, report and record, and I will come back and evaluate my patient.